You want to get an upper blast, where they take some of the excess skin from your eyelids, so it opens up your eyes, or a lower blast, where all the skin is kind of sagging down. Dr. Nassif said, let me treat these areas. Let me do something a little different. He's bringing to us the anti-aging smoother. This is for the upper and lower eyelid. This is a customer pick at $55 for one. If you order this now, he's going to give you a second one. Oh, excuse me, $56 for one. Today, for $6 less than you can buy one, you're going to receive two. So again, the name says it all. This is the under eye smoother. So doctor, when we look at these results, we're talking about this as far as tightening, smoothing, lifting. There's unique ingredients inside of this that are the highest concentrations recommended by the manufacturer to deliver maximum results.
Amy, besides what you just mentioned, there's two interesting things that this does because of the peptides in here, and something called LIFTONIN XPRESS. It actually tightens the skin immediately and long term, so right after you use it, you're getting that tightening effect. It also pushes back the little fat bags. And also with another, besides the EYESERYL, which is an incredible peptide in here, it has pinoxide. Pinoxide helps with the dark circles. So while you're looking at the before and afters of some of the assets, let me just tell you a little thing about your lower eyelids. Now, maybe you've seen me on Botched, where we've actually had to reconstruct botched lower eyelid work, because when it comes to removal of skin on the lower eyelid, it's wrought with complications. The skin is very thin, and then your lower eyelid can pull down, okay? Now, I said, okay, what can we do? Patients come in, yeah, we may do a profractional laser on their skin, on their lower eyelid, as long as the tone and everything is tight, then we can do that. Otherwise, we can't, because again, we can have complications with what we call lower eyelid retraction that pulls down. So when we put this together, I said, what can we do? No, I can't compare this to surgery, obviously,
right,
or to a laser. But I took, okay, what are the complaints? What can I do to instantly tighten my lower eyelid? What can I do to do it long term? So we took an incredible hydrator. We took this LIFTONIN XPRESS, which is a polymer which goes on your skin, and it gives you instant tightening. Instant tightening. We took EYESERYL. This is a tetrapeptide that helps reduce the puffiness and the dark circles, and it helps with skin elasticity. And by the way, we're looking at Donna. She just put it on. They'll probably pull up a before of her after in a minute, and you're going to watch what that does over a few minutes. And then we have pinoxide. This helps even support collagen production and helps with the dark circles in the lower eyelid. So what does this do? Wrinkled, crepey, dehydrated skin. Dark color, pigmentation helps. The puffiness, tightening, lifting, firming. So that's why we call it the under eye smoother. It's almost like not ironing.
Right.
I'm going to say it in a way, ironing your lower eyelid. And because if you look at all the features here, that's what we're doing with this. And please, for everyone, whether you get this or not, just always be careful with surgical treatments of the lower eyelid. Again, from, facial plastic surgeon who does all the reconstruction, please be careful. But this, you're getting two of these. And what I like, Amy, I like it's on auto ship too, is that you're getting better than a BOGO.
Better than a BOGO.
I love saying that.
On something that is so expensive. Eye creams are always so expensive, doctor, and they don't have the ingredient deck that yours has. They just don't. I saw a lot of different eye creams, and they'll instantly tighten in that, but there's no long-term benefits. The ingredient deck that's inside of this, and I was working with Alice, who does a lot of your new product development. The other day, we talked for about an hour. I'm shocked at the amount and the level of ingredients that you use inside of your products. That's why when I talk about pharmaceutical grade or maximum level of that ingredient you're allowed to put inside of a product, Dr. Nassif does. Eye creams are so expensive because of those ingredients, and they're so potent, and this is such a delicate area. This is normally would cost us $55 for one. So for what, $5 or $6 less than you can buy one, we're giving you two. Please secure this on auto ship. This is our final quantity. The number one everybody's talking about is an upper or lower bluff. Why? Because it opens up your eyes. You have an area here called festoons. When those festoons, as we age, that's why it's almost like where the fat kind of sits and you get another line that comes down. That's called our festoons. They can be aggravated for whatever reason. The point that I'm getting to is that as we age, that eye area gets thinner and sags even more. The ingredients that are inside of this, they're designed to lift and tighten that area, that very fragile area. So like Dr. Nassif said, there's so much he can do with surgery, so much lasers can do, but you've got to take care of that skin. And that's what we're doing here today with unique, powerful ingredients. I should actually go that. We're talking about a surgeon grade skincare line. So if you're even thinking about these, read the reviews, always a customer pick. We've never done a duo like this before. There's 500 now left in single ship. That's all that we have remaining. So again, don't wait for this to sell out, where one will be $55. You know you need a good eye cream. Don't wait on this. Pick it up now so you can address that under eye area, again, the eyelid area, because one of the most popular surgeries are upper and lower bluff. Get that home, experience the skin changes you've been looking for. It's on its way selling out. We've got a couple more products we're gonna get to. This is